example, this is the patellar tendon. Next to patellar tendon on the lateral side and on the medial side, this is two needles. Okay, these two needles we use for the cartilage. These two needles we use for the cartilage inside the knee. Okay, when we come on the lateral side, okay, check the joint and here is 2-3 needle here. This is the lateral side of the meniscus tear. Got it? Can you see this one on the side? On the same line of the knee eye. These 3 needle are for your meniscus. Exactly on the same knee here. Here. Meniscus is the filament which is the holding your cartilage. Okay? Exactly like the same. So what we have annulus and fibrosis. This one, can you see the blue line? Annulus fibrosis holding the jelly. The same we have in the knee. That is like meniscus which is holding your cartilage, your jelly. Okay? So yeah. So whenever patient is complaining for pain, more like here, patient saying like I have pain here, that is the medial side meniscus pain. Okay, pain is complaining here, that is the cartilage pain. Understand two difference? Whenever patient is complaining pain here, that is meniscus pain. Okay. When patient is complaining pain here, that is cartilage pain. Again same, paining here, that is lateral meniscus pain, and complaining pain here, that is the cartilage pain.
So some people say there's no fluid or something. Then we go to the meniscus, and some people say there's no gel or fluid. Soup. Then we go and put it in the meniscus.
Meniscus जो सूख गया है जो dry knee, that's the because of the cartilage. Okay. Meniscus mostly meniscus is a ligament. Many people suggest a ligament. Some people are like filaments. But meniscus is purely ligament, which is the holding like 8 shape. Meniscus is like around like this. Okay. So we have the femur bone like this. No, there is 2 head of the femur bone and 2 head of the your tibia. So meniscus is here, around here, like exactly like 8. Okay. This is all the meniscus. The tear of the meniscus happen only here and here, mostly like 95%. Okay, and this is the cartilage. The cartilage is here.
So it's like the nucleus pulpus for this.
Yeah, this is like the nucleus pulposus and this is the annulus fibrosus.
Which is the annulus fibrosus?
The outside one.
Okay, so exactly this 8 is your meniscus. Yeah, so this is the lateral side. If I am standing, this is my left, right knee, then this is the lateral side, and this is the medial side.
And cartilage damage can be healed.
We have very good results still if there is a little bit layer is still alive.
Okay.
Okay, and patient is not very heavy because yesterday we discussed on that lady. I saw like good result when the patient is having a little bit fat.
Yeah.
They get very good fast healing results, and someone is like very skinny. For them, it's a little bit difficult.
How many times?
Yesterday was second
For the
time.
knee, we did second time, I think.
Second, and you already saw the
After one session, there is no improvement. And his husband also suffering with piles and lots of the problems. Within the one session, you feel like there is no single symptom on my stomach. On the abdomen, we have very good result. With that, we will learn later. But and only, of course, knee also very good results. But sometimes, if you are not doing the proper, for example, there is meniscus tear, and we are targeting needle for cartilage, and of course, that will not respond that fast. Okay, this needle is mild painful. This needle is mild painful.
So our patient one, I kept asking him whether your pain is, we were there.
Yeah.
Whether it was here, here, he just didn't identify.
He's just saying
he said
knee
whole
pain.
pain, whole
No,
pain.
that is a pain inside the cartilage. So when you are bending the knee, if you see there is full current sound.
Yeah.
So that also.
That is cartilage pain.
So we tried that yesterday. So when I was holding I did that test, to hold this and feel the karkar. So I thought that karkar is, there are 2 kinds. One is the soft,
The soft one?
and the one is like a bone, when sometimes your bone
Yeah.
So which one is the dry and which one
Okay,
is
which one are you talking for? Which patient?
The fella
the young man who was there?
Okay, so if there is mild and soft karkar, that is like more dryness. Okay, the very mild dryness. The sound is very hard. That is like touching bone.
Yes, so that's not a problem. That's what I thought. So
The dryness is not a problem, or that bone is.
because it's not dryness, it is just the bone that is.
The cartilage layer is fully damaged. Now the one bone, the tibia, is touching to femoral.
So that is problem.
Yeah, of course, problem.
That
Yeah,
sound
of
will
course,
be
when bone are touching, that is the biggest problem.
So then what is that? But that's not dryness. That is not dryness.
No, that is the cartilage is damaged.
So we have to just work on the cartilage.
Yes, so
So nothing to do with your.
Yeah, with these two eye needle, we'll do
Ah,
with this.
okay. I need.
Okay. So for this patient is like cartilage is damaged more than 80-85%. Okay. So if you are inserting the needle, a little bit collagen is coming there. When they will walk, the collagen will damage again. Okay. So for this condition, what we'll do? We do 2-3 sessions. Okay. Or you can go for 5 sessions. If there is a good relief, then we'll continue. Okay. If there is no relief, then I think say no to patients, or you can say, I'll try my best. If you are comfortable, come back to back, we'll try. But I can do my best. I don't know you will get result or not. But within 2-3 sessions, if there is good result, then we can do something.
That guy's a driver now. I remember. He said he drives and he does hard work. That remember that
the
person?
green shirt. Yeah.
Shirt, yeah, maybe.
And the whole family can
Yeah.
with that guys.
Yeah.
So you would treat him for cartilage or meniscus?
Cartilage.
That fella,
Cartilage.
cartilage. So the outsides.
Cartilage,
eyes.
cartilage in the eyes.
Oh, right. Okay.
Meniscus
Oh,
is
yeah,
outside.
sorry, yeah.
Okay.
yeah.
Outside is meniscus.
Yeah.
So meniscus tear is very common tear, especially for those people who is dancing, little bit like this, then meniscus tear. Okay, so we have very good result in meniscus. Mild, the needle is painful, very mild. Okay, because
So I
it is
have
very
meniscus pain. Now I understand.
And you'd use 40 for,
meniscus.
yeah,
No, Baba, only 25.
25.
Very superficial, because there is no muscle.
Okay.
Directly bone, and between the bone, that is meniscus. The first layer of between the bone, that is meniscus only.
Okay.
I'll put needle for you.
I left knee as meniscus problem because now I know.